study's title is Sleep Disturbances and Quality of Life. Sleep disturbances and quality of life in person with chronic spinal cord injury. Spinal cord injury often leads to a range of complications, including chronic pain, reduced mobility, and sleep disturbances. Problems can cause such as insomnia, sleep apnea, restless leg syndrome are common in individuals with chronic spinal cord injury. These disturbances can worsen fatigue, depression, pain, and which can significantly impact quality of life. Quality of life is a key measure in rehabilitation, reflecting an individual's physical, emotional, and social well-being. Despite this, the relationship between sleep quality and quality of life in chronic spinal cord injury population remain underdiagnosed and underreported. This study aims to assess the sleep quality and its relation to quality of life in person with chronic spinal cord injury using validated questionnaires. The primary objective of my study is to evaluate the sleep quality in person with chronic spinal cord injury, and the secondary objectives were to explore the relationship between sleep quality and quality of life in person with chronic spinal cord injury, and also to explore relationship between sleep quality and other factors such as age, sex, neurological duration of injury, complications, and bladder evacuation methods. The study was a cross-sectional observational study conducted in the Department of PMR GMC Trivandrum over a period of 1 month, and the study population included were patients of more than 18 years of age visiting PMR OPD or admitted in the PMR ward with traumatic spinal cord injury of more than 1 year duration. The inclusion criteria were patient with traumatic spinal cord injury of more than 1 year duration and aged above 18 years. Exclusion criteria were patient with spinal cord injury other than traumatic etiology, non-case of psychiatric illness, and patient with non-cognitive impairment. And the sample size was calculated to be 30, and the sampling size was consecutive sampling. Data collection tools included semi-structured proforma, Pittsburgh Sleep Quality Index Questionnaire, and 36 items solved SF36. PSQA is a self-reported standardized tool used to measure sleep quality and disturbances over a period of 1 month. It consists of 7 components such as sleep quality, sleep latency, sleep duration, habitual sleep efficiency, sleep disturbances, use of sleeping medication, and daytime dysfunction. These were scored between 0 to 3, and the component score were summed to give a global PSA score of which ranges from 0 to 21. The score between 0 to 5 indicate good sleep quality, and score above 5 indicate poor sleep quality, which can be mild, moderate, or severe sleep difficulties. SF36, it covers 8 domains, including physical functioning, mental health, physical health, bodily pain, vitality, social functioning, etc. And each domain is scored from 0 to 100. 0 indicate worst health and 100 indicate best health, and higher scores indicate good quality of life and lower scores indicate greater disability. The study procedure, all patients with traumatic spinal cord injury of more than 1 year duration were enrolled into the study, and their demographic details, spinal cord injury characteristics, and complication were recorded. Sleep quality and quality of life were assessed using Pittsburgh Sleep Quality Index and SF36. Coming to the result, this study sample included 30 participants, with majority of them between the age group of 41 to 15 years group, and 90% were males and only 10% were females, and almost nearly half of them having the duration of injury of less than 2 year duration, and most of them having thoracic level of injury, 47%, following cervical and lumbar region of injury. Coming to the complication, pressure sore and UT were the most common complications reported, and only 22% report neuropathic pain as a complication. Coming to the distribution of sleep quality, almost all participants experienced some degree of sleep difficulty, with 50% reported mild difficulty, 40% moderate, and 10% severe sleep difficulties. Correlation between PSQA and quality of life shown a negative correlation, which means poor sleep quality is indicated with a poor quality of life, majorly impacting on the emotional well-being, social functioning, vitality, bodily pain, and mental health, with a low to moderate negative correlation. And distribution of PSQA between age show increasing the PSQA global score increasing with age, which indicate poor sleep quality in older age group, but it doesn't show any significant correlation. Also, there is no significant correlation observed between the PSQ score and neurological level of injury, also duration of injury. And coming to the complication, among the complications studied, only neuropathic pain shows significant relation with a p-value of 0.18. In contrast, pressure sore and UT doesn't show any correlation. Coming to the Coming to the bladder evacuation method, it doesn't show any significant correlation. And sorry, it's not working properly. Coming to the discussion part, the study assessed sleep disturbances among patients with chronic spinal cord injury and its impact on their quality of life. Our study participants experienced some degree of sleep. All study participants experienced some degree of sleep disturbances, with a 50% reporting mild difficulties and 40% moderate difficulty and 10% severe sleep disturbances. There is significant negative correlation between sleep quality and quality of life, with the strongest impact noted in vitality, emotional well-being, social functioning, and mental health. This study found there is no significant difference in age group, sex, education level, pre-mortgage occupation, socio-economic status, and neurologic level or bladder evacuation method. Our study showed PSU score were significantly higher in patients with neuropathic pain compared to those without pain. In contrast, there is no significant correlation noted between patients with pressure sore and urinary tract infections. The study highlights the high prevalence of sleep disturbances among individuals with chronic spinal cord injury, with all participants experiencing some degree of sleep difficulty. Poor sleep quality was significantly associated with reduced quality of life, particularly affecting vitality, emotional well-being, and social functioning. While demographic and injury-related characteristics doesn't show any significant correlation, these findings underscore the importance of routinely assessing and managing sleep disturbances to improve overall quality of life in persons with chronic spinal cord injury. The study limitations were small sample size, which limit the generalizability, and I didn't analyze the PSQ component scores, and use of medication which can affect sleep also not assessed, and lack of objective sleep assessment. These are my references. Thank you.
Thank you, Anjitha. It's now open for questions and discussions. Any questions from the audience? Mike.
That was a good presentation. I think you said thoracic injuries have much more sleep disturbance.
No, ma'am. In my study samples, thoracic injury level patients were more. 47% were patients with thoracic level of injury.
So what is the reason you think that thoracic injuries have more sleep disturbance?
No, ma'am. It doesn't show any significant correlation. The duration of injury and the level of injury doesn't show any significant correlation, ma'am, in my study.
Nothing.
Okay. Any other question? Can I just, we had a, oh, sorry.
Anjitha, good presentation. I think you looked into depression as a part of low sleep. So
Yes,
did we look into whether they were already depressed? Because that also can cause decreased
I
sleep.
excluded the diagnostic cases of psychiatric.
Depression. So
Yes,
we
sir.
looked into it. So there was a questionnaire of whether they were already depressed.
Yes, sir.
Okay.
I excluded that from my study.
Okay. Thank you.
Thank you. There was a large multicentric study done for tetraplegics to look for obstructive sleep apnea. And it was found that 85% was the incidence of sleep apnea in tetraplegic patients. So I find it a little difficult to understand that the tetraplegics and the other levels had no differences at all. Maybe you didn't specifically look for sleep apnea as a sleep disturbance, because most of them don't recognize that they are having sleep apnea. Maybe that.
Yes, sir. Maybe.